My ethical scenario is deferring treatment of a patient who has approved therapy visits just because the therapist knows that they're going to have surgery in the near future. The therapist doesn't want to treat the patient because they will need to start therapy all over again once the surgery is over. So the first potential ethical dilemma is justice. The Occupational Therapy Code of Ethics, the principle of justice relates to the fair, equitable, and appropriate treatment of persons. So the therapist is not doing something that the occupational therapist of ordinary skill, care, and knowledge should do under similar circumstances. The patient needs occupational therapy as requested by the specialist treating physician and will need therapy to increase their range of motion and strength before another surgery. If the therapist decides not to treat, they are not doing their best to provide their client with care, knowledge, and skill. So potential action: although patients lose about 50% of their motion after a surgery, it's going to benefit the patient to go into surgery with the most strength and movement as possible. In order to not be negligent, the therapist should treat the patient as prescribed. Potential professional and liability issues to consider are negligence. If the therapist does not do everything that they think is necessary for the patient, they're going to be negligent. And the decision to put this action step in place is that the therapist should know that occupational therapists are not responsible for patients after injury, are not only responsible for patients after injuries, but also for preventative measures, and they need to prepare the patient for surgery. The therapist can help gain movement and strength to prepare for the loss that will occur after the surgery. The next potential action step is the therapist could see the patient only once and then give them their home exercise programs and have them continue with therapy once the surgery is over and there's a new script. So professional and liability issues to consider is negligence and safety. They cannot only be giving their patient all of the therapy that they need in order to prepare for the surgery, but they also need to be supervised in their activities. So they aren't going to be sure if the patient is doing their exercises in the correct position or doing them correct. The decision for putting this action step is that the therapist will still be doing their due diligence of treating the patient, and they won't be wasting their time or insurance/money. And the patient will still be receiving their exercises and therapy before their surgery, and the therapist will be able to follow their belief that the patient doesn't require more therapy. The next potential ethical dilemma is fidelity, and that's occupational therapy personnel shall treat clients, colleagues, and other professionals with respect, fairness, discretion, and integrity. So the therapist is not treating the patient with respect and fairness when they choose not to treat them for whatever reason that they have. The first potential action step is the therapist should respect the physician's decision to continue therapy and respect the patient's time. Professional and liability issues to consider is the therapist might be dishonoring their own professional opinions if they treat every client the way that the physician says. They need to consider their own expertise and opinions because they have a specific scope of practice and they have the skill set in order to determine what is best for their patient. In order to maintain good relationships with the surgeons and physicians, the therapist should treat the patients according to wishes and protocols. So the therapist should do what's best for the patient while staying within the surgeon's guidelines, and that's the decision for this action step. The next action step is the therapist can have the patient see another occupational therapist if they really don't believe that they are able to treat the patient to their best abilities. So liability to consider is they could be considered being negligent because instead of them treating the patients, they're kind of pushing them off onto another person. And they obviously have an opinion about the patient, so them pushing the patient off to someone else is not going to be the best option. So the reason I put this step in is that the therapist should respect the physician and the patient, but also follow their own ideals and guidelines. If a therapist truly believes that the patient wouldn't benefit from more therapy, they can offer another therapist for a second opinion, and it doesn't hurt to have multiple viewpoints to see what's best for the client. And finally, the last potential ethical dilemma I found was veracity. So the occupational therapy personnel shall provide comprehensive, accurate, and objective information when representing the profession. The therapist is not being truthful when they tell the patient that they don't need therapy until after the surgery. So they need to be truthful with everyone. And so that's the first action step, is the therapist will resolve the dilemma by being truthful to the patient, the surgeon, and the treating physician and other medical personnel involved. If they truly believe the patient does not benefit from any further therapy, that he should explain why to the patient and everyone involved. So professional and liability issues to consider is the therapist is staying within their scope of practice if they choose the option and tell the professional opinion to everyone involved. They might get in trouble or lose the trust of their surgeons by not following their orders, but it's really best to follow their opinion and their professional beliefs. And the decision for putting this in is the therapist has a duty to make sure that the patient is not being taken advantage of. If they believe that therapy services are going to be a waste of time or money, then they really need to be proactive with that client and tell them exactly why. The next potential action step I had was the therapist can tell the patient that they need to go back to the surgeon to talk to them about what they really need and if therapy is necessary. So they kind of let the patient have the responsibility in this. The professional and liability issue to consider is there is going to be trouble because the client, they're not medically savvy. They really don't know exactly what's going on. And so they aren't going to be able to correctly discuss all of their options with their surgeon. So the therapist is not going to be able to do their due diligence of making sure that the patient is being taken care of. I put this as an option because it's really making sure that the patient is being their own advocate, which is one of the best things. So when they talk to their surgeon about their best options before therapy, it leaves room for them to really talk about their options, and also for the surgeons to call the therapist and discuss if therapy is truly needed. But overall, these are all of the action steps that I have so far that I have for treating these patients who the therapist really doesn't believe that they need surgery anymore. And so that is my concept map. Thank you.